Hello everyone, and welcome to the Princeton Public School District Ask the Doctor Facebook event. My name is Dr. Rob Helmrich. I'm the school district physician and have been working in the background for many years to help to advise the district on all things that relate medically to the health, safety, and well-being of our students. Obviously, a large focus of what I've done over the last year and a half has been COVID focused, and I am happy to be here today to do my best to try to address whatever issues I can over the next 30 minutes that relate to the health and safety of our children as they come back in person next week, which we're very excited about. Not only do I work here in the district as the consulting physician, but I also am a practicing pediatrician at Princeton Nassau Pediatrics here in town. So I really have been immersed in many aspects of the pandemic, seeing how it affects our children, seeing how it affects their families. And I really do think I bring a good perspective and expertise to the table as I attempt to answer the questions that you guys have put forth. So first, I'd like to thank everyone who submitted questions. I'd like to do my best over the next half hour to address the questions that come up most frequently, and mainly focusing on those most frequent questions, but also things that are sort of more general themes as we all look towards the reentry of our children. So let me just dive right in. There were many questions that came up related to what our protocols will look like for return to school. And I think sort of the most easy way to sort of tackle that very broad topic is to start off by saying so much of what we will see in this upcoming academic year will look just like what we saw in the spring of our last school year. We will plan to have very many of the same mitigation strategies in place. We've improved many of them. And we will also have some differences as we think about our vaccinated students, staff, and teachers as compared to our unvaccinated students, staff, and teachers. So what will be the same? Well, daily health screenings are still going to be a thing. We realize that creates an extra step for everybody to get their kids out in the morning. I personally have 3 children, and I know what that feels like as we all run the fire drill of getting out of the house in the morning, especially when parents have to go to work as well. But it's just such an important step. It really does make sure we're all carefully reflecting on making sure that our children are well enough to go to school today, and keeps everything at the forefront of our consciousness in terms of making sure that we are keeping our children home if there's any questions that they might be unwell. We ask really just from the bottom of our hearts that everybody do their best to comply with this. So not only filling out the screening every day, but also being honest and definitely keeping any children who are having any symptoms that could be compatible with COVID home. When in doubt, just err on the side of caution, and keep kids with symptoms home. It's going to be one of the keys to our success this upcoming year. The district is currently looking at better technology solutions to try to make things a little bit more streamlined and a little more efficient from what we saw last year. But in some way, shape, or form, there will be a daily health screening that's going to have to be done. We're very fortunate here in the district. We have terrific school nurses, and those school nurses have a lot on their plates right now. They've always had a lot on their plates, but with COVID, in addition to their routine duties, they also are key folks in terms of helping to navigate the responses that families put in with the symptoms screening, the daily symptom screening, and our nurses, when the families have stayed home, they've kept their children home, our nurses reach out and help to guide families through the process of deciding what the next steps should be, helping to make sure our students appropriately seek medical care when they need it, and get COVID tested when that seems like it's necessary. Basically, anything other than the most minor symptom will necessitate an evaluation by a medical provider, and almost always a COVID test as part of that. Our nurses are also our key contact tracers, and so they have a lot on their plates, and so just cooperating with the daily screening, and again being honest and doing the right thing, keeping your child home if they're unwell is imperative. Other things that'll be the same. Just like last year, we're going to have universal masking. We're going to have a strong emphasis on hand hygiene. We're going to avoid shared objects, do things around the school to clean as much as we possibly can. Social distancing is still going to be an important part of our mitigation strategy. Social distancing will look a little bit different in that when children are in the actual classroom setting, we will allow the social distancing to dip down sometimes to as low as 3 feet. Our goal will be to keep as much distance as we can. We'll strive for 6 feet, but we'll accept 3 feet when we need to, when they're seated in the classrooms. Otherwise, it'll be 6 feet everywhere else, as we've all gotten used to, and we'll be especially diligent to make sure that's in place when the masks are off. That'll be obviously when the children are eating, snack, lunchtime, and when they have those mask breaks. So in terms of what's different, right? So, as we look towards as many, if not all, of our 12 and over students being vaccinated, and we're very cautiously optimistic that within the next couple of months, our younger students will be eligible for a vaccine. Things will be different between vaccinated students and unvaccinated students, as well as staff and teachers, in a few ways. So the main differences will revolve around the need for quarantine. At the current time, and again, everything in COVID is a bit of a moving target, but at the current time, our unvaccinated students will continue to need to quarantine when they travel, and they will need to continue to quarantine when they've had an exposure, just like we were used to in the last school year. However, our vaccinated students, again, knowing that COVID situations can change, but as of right now, New Jersey Department of Health, New Jersey Department of Education, and CDC guidance is all in line that our vaccinated students, teachers, and staff will not need to quarantine after travel, and they will not need to quarantine after an exposure as long as they remain asymptomatic. We will ask that folks, whether they're vaccinated or even when they're vaccinated, still monitor themselves very closely for symptoms for a full 14 days if they've been exposed, and also that they get a test 3 to 5 days after an exposure. In terms of other differences, our staff will be very strongly encouraged, our staff and teachers will be very strongly encouraged to get vaccinated. We have every expectation that a large percentage of our teachers will be vaccinated. And for those that are unvaccinated, we will implement mandatory testing on at least a weekly basis. There is a mandate from the governor, and I very much support that mandate. I wish everyone would just do the right thing and get vaccinated. Okay. There are lots of questions that came up as it relates to COVID testing. There are questions about whether we plan to do routine testing and whether we're going to do surveillance testing. And that's a very complicated topic from the perspective, on every perspective, but certainly from the perspective of the district. Routine surveillance testing, in order to be effective, has to be frequent, and it has to involve a large part of our student body. And that uses a significant amount of our limited resources, especially our school nurse manpower, which, again, as I think I said earlier, they have a lot on their plates. And so as we make this decision, and as I advise the district on this decision, we really are balancing the potential benefits of any testing that we might do along with the burden that it will put on our resources. So we'll continue to evaluate the utility of this. At this time, I've not advocated that routine or surveillance testing within our schools be a priority, and that could certainly change at some point in the future. There are multiple factors that are at play in terms of that advice. So first is, thankfully, at least at this time, and we're hopeful that it won't change, but we'll see, Mercer County and Central West New Jersey continues to have less COVID burden than some other parts of the country, certainly, and even some other parts of New Jersey. We've remained in the moderate level of COVID activity, and we'll continue, of course, to watch that. If the level of COVID activity in our community were to increase, to become into that high level as defined by the New Jersey Department of Health, there would be more utility, perhaps, in doing more testing. Princeton Public Schools are fortunate in that, we have, although sometimes old buildings, we do have plenty of space. So our schools are not crowded as compared to many urban districts or other districts around the state. And we feel like we have ample space, and we fully expect to be able to meet our social distancing goals. And finally, I think particularly in this community, which has a strong influence or strong involvement with the university, be it Princeton or other universities in our region, There's a big difference between a college or university setting where students live, or a boarding school where students live, at a school where students, obviously come for the day and then go home. We have full expectation that we can keep our students socially distanced while they're here, and we have full expectation we can keep them wearing masks while they're here, unlike an environment where the students actually live, in which case you really have no control over those things. So that's our perspective on that. And again, that is definitely a moving target and thing. That's something that we're continuing to watch very carefully and having ongoing discussions about. Another question, or another group of topics that came across relates to social distancing. And I think the key question that we saw over and over again in the submission of questions is, why is it okay for 3 feet of social distancing in the classrooms? Why are we not stuck on the 6 feet like we were earlier in the pandemic? Well, I'll start off by saying our goal is to get as much distance as possible. So what I've said to the district is, shoot for 6, accept 3, and if you can't get 3 feet within the classrooms, come up with another plan. So our reason for sort of dipping down to 3 feet is we just don't fit in our classroom settings in every case if we maintain a full 6 feet, and getting those kids back to school and getting them the education, the emotional benefits, the social benefits of being here far outweighs any of our concern at this point about letting things dip down to 3 feet. And so, that is the recommendation of the CDC. It is the recommendation of the New Jersey Department of Health, and it is the recommendation of the Department of Education. And so why are we okay with that? Well, interestingly, the 6 feet rule that we had for last year, it was somewhat arbitrary, actually. There is not good science or good data to say that 6 feet was sort of the magic number. There are some thoughts about how droplets spread and things, but 6 feet was a sort of a starting point. And interestingly, it was not necessarily the starting point of other places around the world, certainly, and even around the country. So there were many places that used 3 feet, or in many international settings used 1 meter, which is like 3 feet, in terms of the distance between their students. And it turns out that the best information that we're privy to shows us that as long as masks were also a part of the equation, it does not seem that COVID transmitted more efficiently or more frequently when children were at their desks in classroom settings with masks on, as close as 3 feet. And so that'll be our plan. And again, we'll continue to watch closely if we're seeing more cases or if we're seeing outbreaks. Of course, we're going to be evaluating every potential factor. But at this point in time, the clear benefit of bringing all the students back to the school environment, benefits to their social, emotional, and academic well-being, I think outweigh any theoretical concern that the 3 feet of distance might be a problem. And hopefully that works out as well as we're hoping it will. Okay, so just getting into some more of the weeds of the questions here. A topic that seems to be very hot in the questions that were submitted are a whole bunch of questions and concerns about masks, right? And so, thankfully in our community, there's a positive response to our governor mandate of wearing masks. And even if the governor wasn't going to mandate it, I was strongly recommending it anyway, and the district was on board with doing it. And so it really is a non-discussion from my perspective that our students will be wearing masks when they're indoors, other than when they're eating or those other very specific situations. So what type of mask is best for children? That has come up multiple times in the questions, and the short answer on that is we should be following CDC guidance on this. So masks, the CDC recommends masks should have 2 or more layers of washable, breathable fabric. Masks should fit completely over your nose and your mouth. They should fit snugly against the sides of your face so there aren't little gaps back there. They should have a little nose wire that sort of holds them tight to your nose so that there isn't air leaking out above the top of the mask. They should not be those ones that have that little circular valve. Although making it more comfortable for the wearer, allows the wearer to expire their expiratory air comes out of the mask, and so it defeats the purpose of the mask. So no valves on the masks. A simple surgical mask, as all of us many of us providers wear in our offices, as long as it fits a kid. So that could be a good option for an older kid. They're disposable. They're gonna meet the standards I just talked about, or of course cloth masks. The littler kids, aren't well served by a typical surgical mask because it's way too big for their little face, and so we want to make sure that the mask fits well. People have raised questions about whether our kids and we should be wearing something more protective than a simple surgical mask or at least 2-layer cloth mask. So the conversation comes up about KN95 or N95 masks. And so that's, there is definitely a higher protective element to wearing those masks, but they're incredibly less comfortable to the wearer, and recognizing that our children are going to be wearing masks for many hours a day, of course with mask breaks. But when we look at this on whole and we think about sort of the risk benefit or sort of the cost benefit analysis on this, not in terms of money, but in terms of comfort and likely compliance by our kids, it seems that the increased protection that the N95 or N95 offers is sort of outweighed by the lack of comfort. And so our recommendation would be to stick with a 2-layer or more cloth mask or a simple surgical mask. However, if a family wants to be more careful and their child is willing to comply, of course, families are always welcome to do something more cautious or more careful. Just as a little side note, in very commonly in most healthcare environments, us healthcare providers, certainly me and all my colleagues in my office, all of the providers in most pediatric offices, and even the some of our pediatric hospitals like Children's Hospital of Philadelphia, other than when caring for known COVID patients and or doing certain medical procedures, a simple surgical mask is all that any of us wear, and we have not seen transmission with just that simple surgical mask. So hopefully that makes people feel a little more comfortable as they gear their kids up to go back to school. There is some stuff out there that has come across, and thankfully I didn't see too much of it in our frequently asked questions, but just in case people are wondering, there's nothing out there to suggest that masks are in any way, shape, or form unsafe for kids. There was a concern at one point in an article that was published briefly, but then subsequently very quickly retracted, raising an issue of whether carbon dioxide can be an issue to children when they wear masks, and that is just a non-issue. It's not a thing. There is a concern about microbes or fungi or things growing on the inside of masks, but that is also not something that has had any clinical relevance whatsoever. We've not seen any illness or anything as a result of children wearing masks. And again, quite the opposite, it's protecting them. They're continuing to amaze me, those little people, as they come into my office, kids as young as 2. Certainly, we encourage everyone 2 and over to wear masks, and we actually require it. And children really are just remarkable in their willingness to adapt and to do the right thing. And as long as their parents model good behavior and they're supportive of this, we see the kids wearing masks really with no issue. I also just want to make a little side note that, as a district physician and as a practicing pediatrician, I can't imagine that people would want to ask for exemptions for masks, but if they do, there are going to be essentially no circumstances except some very, very extreme ones related to very disabled children or very, very unique circumstances. There'll be almost no circumstances where a mask exemption is going to be an option. And so I just want to make sure we put that out there. Okay, making my way through the list here. There seemed to be a theme about what people could do to just overall keep our community safe. What are some of the best practices for lowering transmission outside of school, which ultimately could have positive impact on our schools. And so first and foremost, I just keep coming back to this theme, but it is so important. Everyone who is eligible to get vaccinated should get vaccinated. You protect yourself. You protect those around you, especially those who are most vulnerable. You protect us all from the evolution of more strains, and you help keep our schools open. So first and foremost, what can you do to lower transmission and keep us all safe? Get vaccinated. Second, follow the CDC recommendations. The CDC has especially of late done a good job of putting out good recommendations. Things like wearing masks for public indoor settings, as long as we continue to have substantial or hopefully not high levels of community transmission, even if you're fully vaccinated. If you're in a public indoor setting, wear a mask. Wear a mask if you're in a large outdoor crowd. If you're vaccinated, that's great, but you have no way of knowing that all the rest of the people around you are vaccinated. And if you're unvaccinated, of course, you should be wearing a mask. So large crowds, sporting events, concerts, those kinds of things, large gatherings, even if they're outdoors, wear a mask. And on that same idea, right? If you can be outside, be outside. I've been so impressed with the creativity I've seen in many of the children's birthday parties and various other social gatherings in terms of the cool ways people are using our outdoor spaces. If all things are equal and you have an opportunity to do something outside, whether that's dining, whether that's a social gathering, whether that's a party, do it outside wherever you can. Certainly do not travel if you're not fully vaccinated. And so that's the recommendation from the CDC. So that means people with children under 12 really should not be traveling out of state at this time. Recognizing that, families may not always be willing or able to follow that recommendation. Certainly, if you're not fully vaccinated and you do choose to travel, then you're going to need to follow the CDC travel quarantine recommendations, as those will be our district policy. The district will have a policy, again this year, as we did last year, that anyone who is unvaccinated who chooses to travel will need to quarantine. And so for domestic travel, that's basically defined as traveling to any state that does not directly touch New Jersey. If you're not fully vaccinated, you're going to need to quarantine for 10 days upon your arrival back in New Jersey. However, you may shorten that quarantine to 7 days if you get a negative test 3 to 5 days after arriving back in the state. So. Okay, there are many questions about lunchtime and snack time, right? So, people ask my opinion. What should schools do for snack? What should schools do for lunchtime? Is it okay for there to be snack and lunchtime, even if it's indoors? And what can we do to keep this time as safe as possible? Well, so, on a school by school basis, the answer to the question is going to change in terms of what exactly we're planning to do. But there is a general philosophy amongst all the principals in the district and all the administrators, and certainly my advice, which is to be creative and use all practical spaces that you possibly can, including outdoor space, because you're going to need to ensure 6 feet of distance when those masks come off. So first and foremost, use our space, get outdoors. District is, actively pursuing getting tents up again. And so it's a much easier conversation, probably through the early part of November when the weather is cooperative. As the weather, changes and gets less cooperative, I still think we push the envelope as much as we can reasonably to be outdoors, and we use all of our space. So that's sort of the first conversation, I think, as it relates to how we'll handle lunch. There's some other things too, right? Students facing the same direction as they're sitting at tables, that can help a bit. And remember, there are going to be 6 feet apart. Breaking those students down into smaller cohorts and or having assigned seating, again, on a school by school basis, whichever sort of way works. But the goal there is that if we do have a potential exposure and do need to contact tracing, we have smaller sort of groups, or we know where we know who's where when, so that we can have more efficient contact tracing. Some simple things around the cafeteria, keeping school lunch, obviously as nutritious and healthy as it needs to be, but doing sort of grab and go or box lunch options as much as we can so that we don't generate long waits and long lines waiting for students to get their lunch. Trying to keep sort of the eating time of lunch as short as is reasonably possible, still of course wanting children to focus on their nutrition and some mindful eating, but wanting the eating portion of the lunch, meaning the masks off portion of the lunch period, to be brief as is reasonable, to allow the children to of course have lunch, but recognizing that for most of the kids, the most important part of the lunch period is the social emotional interaction that they have with their peers, their friends. So being creative to get through the eating part, but then still give them that very valuable time to interact. However, it doesn't need to be time at a lunch table with the mask off. It could be time where they step out perhaps of the cafeteria or their eating space and still have their interactive time, but not with their masks off. Okay. a question came across, which I just want to take a second to address, was, can parents request no mask breaks? Well, that's a tough one, right? I think the logistics of that on a school-by-school basis may be difficult to implement. However, of course, a parent can always train their child to not remove his or her mask if that's what a parent, wants to do. I would encourage folks to be cautious about doing that. However, as a person who wears a mask for, probably about 10 hours a day, a mask break just feels great. So just taking that mask off, behind a closed door for me in my office or wherever, to take, a couple of minutes of not having the constricting feeling, that's going to be important for our little people. We're going to be super diligent about enforcing a 6 feet distance, and we're going to try to do those mask breaks as much as feasible outdoors. So, of course, you have to make your own choice, but I would encourage families to allow their children to have mask breaks, knowing that we are going to, do everything in our power to make sure those mask breaks are done safely. There were a lot of questions that came across about the air quality in our schools and in our classrooms, and that so those are things about ventilation and air filters and HVAC and those things, and that is actually a very important part of the mitigation strategy, but it is outside of the area of my expertise. We've got engineers and we've got facilities folks here in the district who are all over this. I can assure you. I think the approach has been to introduce fresh air, work on airflow, work on filtration, and keep humidity low, which is all sort of standard recommendations. How exactly that will look from one school to another will vary based on what they've got to work with, basically, and recognizing that this is important to all of you folks. The district has put out some information. There was a summary of all the upgrades that have been made to our air handling and our air quality, put out to the district website yesterday, actually. So PrincetonK12.org district news has a whole FAQ sheet about our indoor air quality, and I encourage anybody or everybody to take a look at that. And I felt good after reading that we're in a good place as far as this goes. So as we come to the end of our time here, and in closing, I hope everyone found this helpful. Please recognize that I, along with the administrators, the nurses, the head athletic trainer, teachers, staff, everybody's working really hard behind the scenes. We're all looking forward to getting these children back in the building, back in school where they belong. We're all excited to have them back. We are thankful that you are entrusting us with the care of your children. We are really looking forward to them returning. And so, I hope we got through most of the questions that were most valuable or most important to you folks. But please realize, it will be ongoing communication from the district. So please feel free to continue to submit questions to the district. There will be answers put out with our various ways of communication, whether it's Facebook or whether it's our district website, or there are other ways of email, other ways of communication. But we will do our best to make sure we're communicating well, because we know how important that is to all of you as we all look forward to the return of children to school. So with that, again, I thank you for your time and your attention, and thank you to all those who submitted questions. I wish you all the best and happy, healthy, safe school year. Thank you.